Well, though I'm a last speaker, what I'm going to speak is one of the very rare entity, rare and interesting case of a choroidal melanoma which presents as acute congestive glaucoma, left eye in a 55 years. In my experience of about 50 years experience, I have come across one case. And my dad was a legend in the field of ophthalmology and ENT in J&K. Early 70s, he saw a case when he had only direct ophthalmoscope. Today we have got a lot of modalities. We have direct, indirect, A scan, B scan, MRI, CT, fundus fluorescence sonography, OCT, angio-OCT, and yet it's unfortunate that either due to bad luck of a patient or an ophthalmologist the patient. So I'm just giving a narration about choroidal melanoma. This is a Dal Lake and we have got this houseboat. Choroidal melanomas are one of the commonest. I have presented this paper in Massachusetts for about 25 minutes as a keynote speaker, but here in 6 minutes I will just rush. Maybe I will not go the picture. Choroidal melanomas are one of the commonest intraocular tumors which are benign, malignant, pigmented, non-malignant, more in whites than in blacks. They are 80% choroidal, 12 and 80%, 12 and 18, 8% involved in the body and iris respectively. They are about 6.5 per million in USA and 7 per million in Denmark and countries. Very difficult to diagnose because of atypical manifestations. However, by A scan and B scan ultrasound and direct, we just pick up a solid or exudational detachment. Diagnostic modalities are direct, indirect. I have already told you about that. So, what is the presentation? If the tumor is anterior to the lens, patient may come across with a blurred vision, parasitic scotoma, and painless visual loss. If the tumor hits the angle of filtration, patient may come as acute congestive glaucoma, creeping tumor, secondary glaucoma, ocular hypertension. If the tumor hits the vitreous, patient may come across the vitreous floaters. Sometimes ocular pain may be only presenting feature. In very rare cases, you may get loss of appetite, blood control. So in 2011, a 55 years old patient came across with the presentation of acute congestive glaucoma, was put on a full battery of acute treatment. Even all the battery, I mean this osmotic diuretics, 500 cc of intravenous mannitol, he didn't respond to the treatment in 8 hours. So at that time, no B scan, ultrasound was done. He left, he was advised admission, he went Lama, he was sought a second opinion. This time the ophthalmologist of B scan picked a solid detachment. Unfortunately, he was referred for MRI. There was a problem of a radiologist renowned. So he just did not radiologically confirm the melanoma. So there was a mistrust between the ophthalmologist and the patient. He left Lama for 2 years. And in 2 years' time, it was 11 to 13, he was left with a painful blind eye. I saw the patient in 2013 and I was lucky to have the reading of my dad. So I did this MRI, sent him to a very young, who confirmed the radiological confirmation of the melanoma, and his findings were optic neurochiasma radiation and the tract normal, pituitary fossa, basal ganglia normal, midbrain thalamide. So the modalities of the treatment of the melanoma are, if it is less than 22 millimeter, observation, more than 22, ejaculation, plaque therapy, block resection, paraspinal vitrectomy, binaural ventilation. So what I did is I can show you the last picture because I don't have the time. Okay. Anyway. So I did a ejaculation and then I put what we call as an intraocular orbital mold to increase the intraocular volume for a better fitting of the prosthesis. After 15 days of the removal of this mold, I put a prosthesis well fitting. Now, the thing is that when histopathology of this was done, luckily it was benign. So the thing is when you talk about this discussion, that whenever you have a patient with acute congestive glaucoma who is not responding to routine, please do a B scan. Pick up the solid exudate detachment and do an MRI. And then in this patient, what happens is that basically In the beginning, BCScan was not done. And then when it was done, there was a problem with the radiologist. So I got some references. In Boston Palmer Ophthalmology University of Miami, two patients have choroidal melanoma present acute glaucoma. One patient was put on anti-glaucoma medication, other patient has a head media, and making it difficult of the posterior segment to be visualized. MRI confirmed melanoma nucleation done. Similarly, Institute of Ophthalmology in Manchester, a patient of acute glaucoma did not respond to this anti-glaucoma medication, and MRI done, confirmed choroidal melanoma nucleation was done. The melanoma of a ciliary body are very refractory treatment. Sometimes you have a case like vertex viruses, which presents as a UL melanoma, but is benign condition. Thank you very much.